Thank you, Carl. And I wanted to thank the Pipeline Safety Trust for the opportunity to come and speak to you today. I'm going to talk a little bit about an incident that occurred in Calhoun County, Michigan. A lot of people refer to it as Marshall, and Marshall is obviously a city within Calhoun County. Calhoun County is in southwest Michigan. We have a population of about 130,000 residents, and we did experience a pretty significant oil spill. It was an Enbridge pipeline that broke or ruptured on July 26, 2010. And what I'm going to do is talk a little bit about, all day long you've kind of heard pretty broad perspective and high-level discussions relative to the pipeline industry. And I think other than the California incident, this is similar to that, other than we didn't have any fatalities, and that's a positive. The incident itself was a 30-inch pipeline ruptured on Monday, July 26th at approximately 9:45 a.m. in the city of Marshall. The release was estimated at about 840,000 gallons of crude petroleum that ended up into a wetland, ultimately seeping into Talmadge Creek, and it flowed ultimately into the Kalamazoo River, which is a Lake Michigan tributary. You can see here, it's a good thing that there's no OSHA regulators in the room, and if you're going to take anything away from this, from a standpoint of this particular picture, make sure that your contractors have on the equipment that they need to have on, because obviously in the top right picture, they don't have the correct equipment on. But you can see that there was a significant amount of oil spilled in many environmentally sensitive areas. This was the largest environmental contamination not only in the state of Michigan, but also in the Midwest portion of the country. The cause was a massive 6-foot-long rupture in what's called the Enbridge 6B pipeline. It's a 30-inch pipeline that's quite antiquated and was installed in 1969. The line itself runs from Griffith, Indiana to Sarnia, Ohio, and has a capacity of 290,000 barrels a day, which is, what's that equivalent to in gallons, real quick? Millions and millions and millions of gallons a day. The contaminant obviously was crude oil. It's a tar sand that Enbridge pumps through the oil or through the pipeline. It's a mixture of different hydrogen and carbon-based chemicals, normally called hydrocarbons. The area that was impacted was about a 40-mile stretch of river. You can see that the red star there denotes the rupture site and goes about 40 miles west, impacting Talmadge Creek, which feeds into the Kalamazoo River and goes all the way through Calhoun County and then into Kalamazoo County. So a pretty significant stretch of river was impacted. So just to talk a little bit about where we're at with the cleanup, and this has been ongoing for about 16, 17 months now, and we've spent a significant amount of time with EPA, the Department of Community Health, the Michigan Department of Community Health, the Michigan Department of Environmental Quality, Enbridge, and all their contractors in pursuing the cleanup. Right now, and this is a little bit of a head scratcher here, because the previous slide I talked about 840,000 gallons. Now we're looking at the EPA website, and they've indicated that just over 1.1 million gallons have been recovered of oil. And I talked to some of the Enbridge representatives today, and we'll talk to EPA about this, but I think that what we're looking at is there's more than just oil being calculated in that total number. 15.7 million gallons of oil and water collected and disposed, about over 150,000 cubic yards of soil and debris has been disposed. Last checked, there's about a little under 800 personnel on site. That's winding down rapidly. The temperatures in Michigan are dramatically dropping, and we're getting very cold mornings with frost in the air. To date, there's been about a little over $36 million spent on the actual cleanup. Just a story I want to relate to you. When I started on this, almost a year and a half ago, Pat Daniels, the president of Enbridge, stood up, and I'm not here to bash anybody. Enbridge has done a good job. They've been a very responsible party. But the president of the company did stand up and indicate in front of hundreds of people in my community that Enbridge would not leave until this job was completely done. And what I took away from that was that completely done means that all of the oil is removed out of the water system. And I was at a meeting about a month ago with one of the main individuals, and I'm not going to name his name, but one of the individuals had got up publicly and indicated that they're not going to get all the oil. That we've got submerged oil, and this is something that's going to be there until I don't know how long, probably the rest of my life. So that's been a frustrating point for me. Our role was quite involved. We have the authority in the Public Health Code to ultimately close the river, evacuate unsafe areas, ban the use of water for irrigation and drinking purposes if necessary, develop air monitoring. And again, we worked in unison on the Unified Command with other state and federal agencies to be able to make these decisions, provide staff for call-in centers. We did syndromic surveillance initially to determine individuals that their health was impacted as a result of the oil spill, and then continued to respond to health complaints, working with predominantly physicians in the area, our family health center, which is a federally qualified health center that would help see our indigent population. Done a lot of groundwater sampling, continue to do groundwater sampling, and then a lot of other issues dealing with the response. Immediate health concerns dealt with the volatile organics in the air. We found that the crude oil caused a great deal of odor after the rupture. I can remember driving home that next day, actually, after being at the site for probably about 16 hours at the command center. And I live probably a good 24 miles from the rupture site. And as I kept driving back, the odor was just overwhelming, and it was just the odor. You're all familiar with the odor because you're in the business one way or another, but it's just the odor you get when you're having your driveway asphalted or something like that. But I can remember I kept getting out of my car. I'd get out after a mile, and I'd say to myself, geez, it still smells. I'd get out after 5 miles, and it still smelled. It got up to about 12 miles before I didn't really notice any of the odors in the air, so that was quite significant. And those odors went on for weeks afterwards. And there were a lot of populations in our community that were exposed to those odors. And even though we got information from the Department of Community Health and representatives from the CDC that these are short-term concerns, this isn't considered a long-term health issue. We still have a lot of people in the community that really aren't satisfied with that answer and that feel that they've had long-term exposures as a result of this. And then one of the things, too, that I've identified early on was that some people had a very low threshold for sensitivity to volatile organics. And Deb Miller, one of the residents in my community, will be the first to attest to that. We have some people that were around it, all day long, 8 hours a day, and they didn't really have any of the symptoms. And you have some people that were around it that have high sensitivity to those compounds that any exposure whatsoever automatically gave them nausea, a sore throat, headache, irritations, vomiting. So there's a whole wide range, and that's true with any type of asthma as well. There's all sorts of triggers, and people respond differently to triggers. Now, we continue to get a lot of questions relative to long-term health issues, and the chemical that is of the utmost concern, obviously, is benzene. Benzene is a colorless liquid with a sweet odor that's a natural part of crude oil. Long-term exposure to benzene can lead to leukemia. Residents have been concerned about the long-term health effects of exposure to the oil, and I haven't been able to answer them. We're a relatively mid-sized county-level health department in Michigan. I have 60 employees. I have a medical officer that I contract with. I get him about 10 hours a week. His specialty is chemical disease. It's not toxicology. I've relied on the state to provide toxicologists, and they've done a good job with that. But even the state really can't answer this answer of, should I be concerned about long-term health issues? So about 6 months ago, I submitted a request to the Agency for Toxic Substance Disease Registry, which is ATSDR, which is a sister agency to the CDC. And finally, I did get a response relative to a long-term health study. I'm not going to go into a lot of detail about that other than to say we won't be getting a long-term health study in Michigan. However, we are coming up with a plan of educational approaches towards the physicians in the community as well as to the community in whole. We'll be doing those presentations and education opportunities after the beginning of 2012. And then we've got a lot of lawyers, not a lot, but some attorneys in our community that are beginning to get together with potential class action suits, and that continues. Initial response to from our perspective, from the state's perspective, was air monitoring. We don't have an air monitoring program at the local public health department, and I can tell you that in Michigan, there's probably no local public health department. Even Wayne County, Ottawa County, some of the Kent County, some of the bigger health departments don't have resources for indoor or outdoor air monitoring programs. We can barely do mold programs, and programs that we used to have dealing with air quality have been dismantled tremendously over the course of the last decade. And public health has significantly been reduced financially from the standpoint of program development. So we relied wholeheartedly on EPA consultants and contractors to do the air monitoring. You can see some of the equipment that you're probably many of you familiar with, and so are our residents because they've been seeing these things hanging off their backyards for the last 16 months now. This was the evacuation decision. We did end up evacuating a small area within the spill site. This was a decision tree that was used in unison with Department of Community Health and the EPA to basically make decisions. We used decision trees for everything that we did so that we had science to base all of the decisions upon, and then we could reverse that in the event that we wanted to lift evacuations or lift the bans on water supplies. Again, I talked a little bit about the evacuation of the residents. We had 61 homes that were evacuated. We went out to each and every one of these homes in unison with the Department of Community Health. A lot of them had already left. Enbridge did a very good job of relocating any of these individuals. To date, I think Enbridge has purchased over 120 homes, last count, of areas or of homes that had significant impact. I would think that all of these homes, from an environmental standpoint, are very marketable and will probably be sold or are in the process of being sold over the course of the next half year. You can see from this aerial map, this red dog-leg represents the area that we evacuated, and then the areas that were in yellow are areas that were considered for evacuation. But based upon the structure of the decision tree, they never were actually evacuated. Groundwater monitoring, initially we identified about 200 what's called sentinel wells. These are what you would refer to as the canary in the coal mine wells. These are shallow wells with fractured bedrock, the most vulnerable water supply systems that we have. We constantly kept an eye on those to, if there was going to be contamination infiltrating through any of the aquifers, it would have shown up in these close to the spill site proximity wells, as well as the fact that there was no overburden or a substantial clay layer to prevent that oil from seeping down into the water supply. To date, we've had thousands of water samples. Enbridge has put in a lot of test wells, and knock on wood, we haven't had any contamination show up in any of the groundwater supplies. And I've had conversations with some of the residents about this, but I truly believe that because of the viscosity of this type of material, I think that the vast majority of it was removed before we had a lot of downward penetration into the upper layers of most of the contaminant was found within the upper couple feet of the material. Even though Calhoun County is a relatively sandy area, I don't think that we're going to see this show up in our groundwater. And if it does, it will be a whole new chapter. We relied wholeheartedly on help from all over the country, toxicologists from different parts of the country, from the CDC, from Atlanta, Department of Community Health. We had occupational specialists. We had physicians involved with this, industrial hygienists, engineers. We have an epidemiologist on staff, and accountants. We had politicians there as well, and sometimes that's to your advantage, and unfortunately sometimes it's to your disadvantage as well. Nurses and environmental specialists as well. Impact on the animal. Many animals were impacted as a result of the spill. Over 5,000 turtles have been decontaminated. Canadian geese, swans, great blue heron, sandhill cranes, muskrats, frogs, and fish all have didn't have any major fish kills or major animal kills. And Enbridge did a very good job setting up an animal recovery center and brought in some really good veterinarians to be able to run that facility. Communicating with the public, a lot of different methods were used and mechanisms, call-in numbers, walk-in centers, community meetings, mailings, mass phone messages, television, newspapers, all sorts of different venue or vehicles were used. The public response overall has been somewhat good. The response has been varied. For the most part, a lot of people have been pleased with it. Some have not, and some have been frustrated with the fact that they felt that we didn't move fast enough, that we haven't answered their questions, and I'll be the first to admit that I haven't been able to answer their questions. And I've had people come up to me and ask whether or not they think I'll get cancer or they'll get cancer in 10 years as a result of this, and I can't answer that question. Some are not happy with the response, some that felt it would be done quicker. Again, there's long-term public health questions that we hope that we can get answers from the federal government, from ATSDR, from CDC and such this winter. And again, there's still some long-term environmental questions. The biggest problem that I have with where we stand right now is the submerged oil. I'd like to work with universities over the course of the next 5, 10, and 15 years. Michigan State comes to mind as one of them because they've been involved in this watershed in the past. But I'd like to work with getting them commissioned to do some type of long-term study. We also talked offline today about the feasibility of a long-term health study at the university level as well. We had a lot of partnerships, and I put Enbridge up there because, again, Enbridge was a very good partner throughout this, and sometimes I've never not said that because they have been there, and I've been accused of being in bed with Enbridge and all sorts of things. But the reality is I would really hate to think of going through this process without a responsible party, and Enbridge has been very responsive to everything that we've asked them to do. And then there's a whole litany of other sponsors and partners, and we couldn't have done it without the level of partnership that we had throughout the process. What I try to do, and again, I know I'm preaching to the choir, and I'm preaching to a lot of regulators that know a lot more about oil and pipelines than I do, but when I go out and do this presentation to other communities and to other health officers in the state of Michigan, I always try to indicate that, you know, as we've identified earlier today, there's been a lot of lax regulation on this industry. Inspections dating back to this particular pipeline, just going back to 2007, identified over 390 defects in this line. This particular portion wasn't even considered one of the major defects, so that makes me really worry. Since then, only 6, and this is a little dated, but only 61 of the defects have been repaired, leaving 329 unrepaired. I feel as if we're leaving the kids in the candy store with the keys. Much of the oil and the gas line and infrastructure, and you know, we talk about, particularly in Michigan, we talk all the time about the condition of the roads, the condition of the bridges, and they're a mess. But people don't even realize the condition of the stuff that's underground. That's what's really scary. Lessons learned, and that's not my dog. Local leadership is imperative. On-the-job training, there's no playbook, and even the experts don't have all the questions. And I can remember sitting in a room with the EPA when someone came in with a video of the submerged oil, and it was never on our radar, but he was poking a stick, and they actually, it was an EPA employee poking a stick, and all of a sudden up gurgled just tons and tons, not tons and tons, but bubbles, bubbles and bubbles of submerged oil. I looked over at the EPA representative, and he said, I never saw that coming. So even people that have been doing this for 25 years in the EPA are still scratching their head saying, I didn't see that ball coming our way. So don't ever think that, that anyone knows all the answers. And don't think that it can happen to you, because it can. And then, the only other thing I want to say is always we try to put ourselves in the positions, and I didn't do this before, and oftentimes I would I wouldn't have empathy for the people that were dealing with this until you sit and go through and watch what is happening to them. And quite frankly, thousands of people have had their lives turned upside down as a result of this. So, I appreciate your time, and I'm going to move on for the next speaker.